Welcome to special edition of Tekedia Daily. I'm Ndubuisi, Ekekwe. I'll be speaking on Medcera and the partner development pipeline, which our partners in this health tech company can actually explore. So we want to thank everyone who has signed up through his organization or through his entity to become one of the partners to Medcera. Medcera is an electronic medical record system, which makes it possible for every entity in the medical field, from doctors to nurses to pharmacists, insurers to indeed from lab, imaging center to clinics and hospitals, anyone can coordinate and correlate and collaborate within the online system. So the Medcera has what we call the patient portal system, making it possible that patients can book appointments, can control, manage a medical record as necessary. That means that when you go to one clinic in Nigeria or in Africa, possibly, if you go to another clinic with the same Medcera system, that medical record is automatically available to that particular entity. So you don't have to carry a physical paper from one hospital to an imaging center or to another hospital, because once available in your own account as a patient, any hospital you give approval to have access to it will automatically do so. So once we have done that, we begin to have an operating system which makes it possible that we can improve patient outcome, can reduce errors, and the good thing is that there is nothing to stop. So we've been looking for partners, people who can join us to send the message of Medcera across different markets, across different communities and cities. And some of you, we have signed partnership agreement already. Now we're also sending proposals, documents that you can adapt and customize for the needs of your specific market. That also included the one-page Medcera summary, which essentially gives you a very good understanding of what Medcera is all about and what the services and solutions are. So Medcera, is explained, has all these elements. It has really three core parts. The web-based electronic medical record system, which is what we call the anchor, the real stuff. And that is where the physicians are connected. Then you have the patient part of Medcera, which makes it possible that patients can see their medical history. They can also track the prescription. They can make appointments. They can schedule hospital visits. They can go to labs. They can go to imaging centers efficiently and effectively. They can also pay their bills right from the patient portal system. Then we have what we call the connect partners. These are like pharmacy, insurance, labs, imaging center. All these are all integrated within one ecosystem where all of them correlate and work. So we believe it's something very exciting because Medcera is free. It's not, you don't have to pay anything. Our job is to delocalize the whole construct of medical record. Your medical record, whether you are in Ghana or whether you're in Nigeria or whether you're in Lagos, Nigeria, from Aba, Nigeria, should not be localized. Anywhere you are, your doctor should have access to it because it's still the same person. There is no reason why it should be bounded by geography or space. So all we are doing is making it possible to have an integrated healthcare system at scale. And our system delivers that. We believe vividly as we continue to advance this solution, we're going to pioneer in our localities across different African markets, personalized medicine. If someone has a very good understanding of your state of your health, it's possible that artificial intelligence in future can actually make it easy for that person to deliver more personalized healthcare services to you. It's very important because we need to have these elements so that we can improve patient outcome and save more lives in our communities. And this is going to be very powerful. Schools, companies, and states, military units, there are opportunities where the ability to manage people's medical record, our ability to find deeper insights to help treat people, very, very catalytic in our lives. So in the pipeline opportunities available in Medcera, to our partners, we just want to bring to your attention that government remains a very critical enabler of any business strategy in the continent. Except, for instance, you go to a state government, a federal government, even a local government, and you tell them that there is this technology that if you connect this technology, if you make it available by saying we are going to adopt it, every system in that locality just have to go and have an account, and then you encourage all the clinics or the labs or the imaging centers that this is a choice that you can actually connect because it's free. The essence here is that as more people connect, as more people use it, it is going to become an enabler in your healthcare system. Because what is going to happen here, the cost of healthcare will drop because there will not be any need of repetitive medical diagnosis or repetitive medical labs and tests. So once that data is available in one clinic, it's available in others under the highest ethical, strongest privacy policy available in the medical sector. So the patient has control to say, this doctor, you are the only one that can see because I have the Medcera code, which is a number that is given to every patient upon registration in the portal that makes it possible that unless you give that to a doctor, the doctor cannot pull your medical information from Medcera. But once you give it to that doctor and the doctor types it into the system, then your medical record can come out. And then the doctor can now make you a patient in his or her own clinic, making it possible that information becomes readily available. So from government, you have military units, police, and law enforcement systems. Imagine if you have a military, go to a military unit. Soldiers are constantly being posted from one location to the other. And once they are posted, they are moving from one clinic to the other. Imagine a scenario where you can give them an electronic medical record system that is unbounded by geography. So they move from Lagos, they move to Kaduna, they move to maybe Mali. And if they are using Medcera, what happens here is that irrespective of their locations, irrespective of where they are moving them, that medical record remains available to any doctor, to any physician that will be taking care of them. That is the beauty of what we are doing. So instead of saying, oh, you are now in Kaduna, Nigeria, oh, your medical record is in Lagos, Nigeria. No, irrespective of where that individual is, that record is available. The same thing applies to police. The same thing applies to any person in the healthcare and the law enforcement sector. So you go to these entities as a partner. You tell them there is an opportunity if they adopt the system. Of course, we have schools from primary to university level, and you tell them, say, come here. I ask your students to go to Medcera and sign up. It's a free account. Let them begin to use the Medcera code as they go to clinics and hospitals and doctors. The essence of this is to make sure that there is a huge opportunity that they can keep and track their healthcare lives. So the guy is in the university and he has gone to clinic and he graduates from the university, he goes to company. If he can maintain the same account, he can see the trajectory of his health life. And it's very, very important because if there are patterns, it makes it easy for doctors to understand what happened. And of course, companies can also do the same, making it easy for their staff to onboard into Medcera. And then when they onboard into Medcera, it's going to make it easy for them to actually provide better care to their staff. We are looking for that opportunity where you can bring in integration of citizens and people in bulk. You bring them as a school, you bring them as a university, everyone has gone to the university health system to say, here, every student has to register to Medcera, and when you are coming in, please come with your Medcera code so that the university can use that to manage everything we do. All we need to do is to create a Medcera interface for the university. And that is it. They don't even need to have any system right there. All they just need to make sure that their connections to the internet is intact. So that's what we're working on here. And that is what Medcera is built for. And we offer all these opportunities that you can pay these entities if they need any level of customization to suit their specific needs. Medcera will do it. And also we offer training where it's necessary that people need to be trained in order to get better in what they're doing. And if there are also cases where paper-based data, they want to migrate into the digital domain, Medcera can help. And these are opportunities we want you to pursue. To pursue these opportunities of all these core areas. Then you can explore possibly if these entities are going to need any service, customization, training, data migration. And there are so many. Even farmers union, cooperatives of farmers, even road transport workers association. These are organizations. You can approach them as a group and say, we want all of you to go and have this account so that when you have this account, your healthcare system can be more efficiently managed. As you bring them, we can create an interface and customize it to say health trade union Medcera.com, making it possible these entities can have a very well structured interface for them to get into the healthcare system. We believe it's so exciting because we are confident that we're going to improve patient outcome, we're going to lower costs, we're going to reduce medical errors. We've done this thing in a system that all you need is just internet access. You don't have to install anything. Pass this message to your clients, pass this message to your potential clients. Talk to government, talk to institutions. That's what you are in as a partner to Medcera. Thank you very much. You're listening to the Tekedia Special Edition by Ndubuisi.